Okay, I am going to be administering a topical medication to Mr. Jackson today. I would start out by having my MAR pulled up, whether it's the EMAR or the paper MAR. That way I can just double check the patient information, the date of birth, any contraindications such as previous medical conditions, any things wrong with his skin that I should be aware of before I apply a patch or a medicated cream or lotion. So then I would start off by making sure that he doesn't have any allergies to any patches or the drug in the cream or patch I'm going to be applying. And then I'm going to make sure that his date of birth, his medical ID number, and all that is going to match up with the patient. So first off, I'm going to introduce my patient, or me to my patient. So it'll be, good morning, Mr. Jackson. My name is Katrina. I'll be your TMA today. And then I'm going to perform my hand hygiene, wash my hands. And then for this, I am going to wear gloves because it is medicated patch that I'm going to be applying with my hands. I'm gonna have the gloves on after I've done my hand hygiene. Now I'm going to do a face-to-face with my patient and just double check that his date of birth and all there is in there to make sure I've gone through my 5 rights of medications, as well as the 3 medication checks. So I'm going to introduce myself to Mr. Jackson here. Good morning, Mr. Jackson. My name is Katrina. I will be your TMA administering a medicated patch today. Can you identify your date of birth? Yeah, it's May 1st of 1957. And that's going to match up what I have in my MAR. I'm going to go ahead and ask if he has any allergies or any discomfort in the area I'm about to apply the patch, just to make sure that the patch isn't going to cause any further problems. So do you have any allergies today, Mr. Jackson? Nope, just morphine. Okay. Do you have any concerns with either of your upper arms this morning? No. Okay, he said no. So now we're going to go ahead and provide some privacy. Ideally, you'd want to provide for privacy before you enter the patient's room to talk about the private information, and then put the gloves on after. So I'm going to make sure that he is positioned properly. So privacy is provided, the curtain's closed. I've done my 3 checks for this medication that I'm going to be administering. And then I'm also going to make sure that there is a order from the nurse on my unit or my nurse manager to make sure that this in fact is what is going on Mr. Jackson today. So I'm going to take a look at the arm again and position him so he is in the upright position and his arm is out and in a comfortable position for me to apply. I'm going to make sure that there's not too much hair on his arm before I apply this sticky patch. I'm also going to make sure that there's not already a patch in place and that I am not putting it in the same place where the previous patch or cream had just been applied. So I am going to take a look at my medication. It's going to be a fentanyl transdermal patch. It's got 5 milligrams of fentanyl that'll be delivered. I'm just going to make sure it's not expired as well. Nope, we're good. It expires June 1st of 2032. And then I'm just going to review the instructions for the medication per the manufacturer. And this one is just to remove the sticky tabs on the back. Make sure you have gloves on so you don't get a dose of the medication. And then we are going to go ahead and put on the patch. So we're going to open the patch up. And then we're going to take it out. So here is the patch with the backing still on it, out of the package, and I'm holding it with my gloves. So then we're gonna go over to Mr. Jackson. And we're gonna place it on his arm. So I'm gonna start by peeling off just one sticky side. That way it doesn't stick to me or stick to anything else. I'm going to put it on an area where there already hasn't been a patch or a cream. Peel that one side I've already started off. Make sure it's in a good position. And then I'm going to peel back the other side. Oops. So there it is. And another thing I'm going to do is make sure that I have also put my initials and the date on it. That way, other providers, especially on other shifts, are aware that he does in fact have a patch, because some of them are either skin colored or blend in. And that way people can identify that I have placed it on the patient today. And also marking it off in the MAR that I have placed the patch on his right upper shoulder, and that I've dated it today, and that I've signed off on it in the MAR with today's date and the time. That way people know how long the patch is on, especially if they're coming on an evening shift. They can say, okay, this patch is met. It's not going to provide any more medication, although the patches do still have little traces of medication in them. So once the patch is placed and it's comfortable on my patient, I've done my 3 medication checks. He's in a good position. There's no discomfort with the patch. I'm going to discard of the packaging and the backs on there. I'm also going to take off my gloves after and do my hand hygiene again, just in case that there's anything that went through the gloves or any things from the patient. So I'll do my hand hygiene. And then I'm going to place the call light within reach. That way Mr. Jackson can call me with any concerns or needs in the future. And then I'm also just going to monitor and make sure if there's any changes to the patient, like pain level, discomfort, any allergic reactions and whatnot. I'm going to report that to the nurse. And then again, just making sure that it's documented, whether it's on a paper MAR or the EMAR, that I gave the patch today on May 20th of 2026 on his upper right shoulder. And I'll sign off with my initials as well as leaving my full name. That way they can identify who did it.